friends, myself Sonia John, assistant professor working in Biyani Institute of Science and Management. On behalf of Guru KPO, I am going to deliver a lecture on appendicitis. So today what the topic we are going to deal is with appendicitis. Append plus itis. Append means appendix and itis means inflammation. So the definition of appendicitis is, it is the inflammation of the vermiform appendix. If we move on to the anatomical structure, this is the large intestine, this is the ascending colon, this is the transverse colon, this is the descending colon, and this is the sigmoid colon. So this small finger like appendage which is attached to the ileocecal valve, it is known as appendix. And if any type of inflammation occurs in this, any infection occurs in this small finger like appendage, it is known as appendicitis. Next we move on to the causes. What are the causes of appendicitis? So first we can see most common in emergency abdominal surgery. So if the person has gone in an emergency abdominal surgery, the patient can have appendicitis, or there may be any inflammation that can cause in the appendix and that can lead to appendicitis. Next is infections. We know any type of infections that occurs in the appendix, so it can lead to appendicitis. Next cause is obstruction of fecal matter. If any of the fecal matter has been obstructed in the appendix, so it can cause obstruction, and because of that obstruction there will be decreased blood supply to the appendix. So there will be appendix lumen inside the appendix. So what happens is there will be increased pressure, and there is lack of blood supply, which can cause edema and which can lead to inflammation, or it may even get rupture. So next one is inflammation of the colon. In this colon, whether that mainly the ileocecal or in the ascending colon, if there is any type of inflammation in the colon, it can occur to appendicitis. So we have seen the causes. What are the causes? Once again we will see. The first cause is if the person has gone any emergency abdominal surgery. Second one is infection due to any of the infections. Third one is if there is any obstruction due to any fecal matter, if any fecal matter get obstructed and because of that any inflammation occurs in the appendix which can lead to appendicitis. Next one is inflammation of the colon. If there is any type of infection or inflammation of the colon, it can lead to appendicitis. Further we move on to the signs and symptoms. Signs and symptoms are through which we can, the symptoms, the signs they show which presents the disease. So what are the signs and symptoms? The signs and symptoms are, the patient will have abdominal pain. First of all, what will happen? The patient will have abdominal pain, that he will have mainly abdominal pain, and the pain will be mainly at the right side. The pain will be located at right side. Next one is patient will have anorexia, that is he will not have the sensation to have food, that is he will not feel hungry. So the person will have anorexia. Next signs and symptom is the patient will have nausea or vomiting. Nausea means the patient will be having sensation of vomiting, and with the sensation of vomiting sometimes the patient will even vomit. Next, the signs and symptoms is pain at the McBurney's point. Pain at the McBurney's point, it is one of the signs through which we can analyze the patient as having appendicitis. The McBurney's point is it is a point from the midway from the umbilicus to the right iliac spine. The point will be at the midway from the umbilicus to the iliac spine. So the patient will be having pain, right? This is the umbilicus. So from this umbilicus, what will happen? The midway between the umbilicus and the ilium spine. So what will happen? The midway, this sign is this place, the pain will be there midway between the umbilicus. This is the umbilicus, and this is the iliac spine. So what happened? Right side, it will be the pain will be in the right side, and which will be in the between the umbilicus and the iliac spine. This spot is known as McBurney's point. Next, the sign to which we can analyze is Rovsing sign. In Rovsing signs, what happened, that we can analyze how when we are palpating at the left side, so the appendix at the right side. So if when we are palpating at the right side, so what happens when we are palpating the left side, so and applying pressure, what will happen, the bowel will pass from bowel movement will feel. So what happens, at the time of giving pressure at the left side, the person will feel pain at the right side. So by this we can distinguish the person is having appendicitis, and the sign is known as Rovsing signs. Next, the patient will be having constipation, that is the patient will have hard stool and he will be having trouble in passing the stool. Next, abdominal distension. There will be abdominal distension. The person will feel, as the bowel content is not emptying properly, so the person will feel, or the person will have fullness of stomach, and which is known as abdominal distension. Next, the person will have local tenderness with pressure. So what happened, when we are applying pressure, the person will have pain, and on touching the person will feel pain, and he will have tenderness on the right side when we are applying the pressure. So these are the signs and symptoms which we have discussed. Further, we move on to the pathophysiology. So pathophysiology means how the disease progresses in one's body. So how the appendicitis further progresses in one's body, that we know through the pathophysiology. So due to infection or fecal stone or obstruction, if there is any type of infection, or because of fecal obstruction, or due to any fecal matter, or due to any obstruction that has occurred in the appendix. So these are the etiological factors, that is due to the etiological factors. The etiological factors are either it may be because of infection, or it is due to any fecal matter, or it has been caused because of any obstruction. So what happens due to infection of fecal stone and obstruction, what will be happening there? So the obstruction will be present in the appendix lumen. See, here it is given obstruction in appendix lumen. So what happens, the appendix lumen will be obstructed. So what happened when the appendix lumen is obstructed, there will be increased intraluminal pressure in the appendix. Inside the appendix, what will happen, the pressure will be increased, and because as the pressure has increased, there will be disturbed blood supply, that is adequate blood supply won't be getting there. So what happened, as a result of disturbed blood supply, the person, the appendix will or the surrounding place will get edema. So there will be edema, and because of this disturbed blood supply and edema, so what happened, there will be rupture of the appendix. As the infection is progressing, there will be disturbed blood supply, edema is there. So what happens, because of edema, what happens, it will be full filled with swelling. So what happened, because of that swelling and inflammation, there may be rupture which can occur, that is perforation of the appendix can occur. So what is the pathophysiology? Due to infection or any fecal stone, or due to any obstruction, what happens, there will be appendix will be obstructed, and because of this obstruction, what will happen, the intraluminal pressure will be increased, and as a result of intraluminal pressure increase, there will be obstruction in the decreased blood supply in the lumen. So there will be decreased blood supply, and because of this decreased blood supply, what will happen, the lumen, the appendix will be getting edematous. Because of edematous, that will cause to rupture. So due to infection of fecal stone and obstruction, that will lead to obstruction in the appendix lumen, and which will lead to intraluminal pressure, increase the intraluminal pressure, and which leads to disturbed blood supply, and which leads to edema, and which can cause rupture of the appendix. So this was the pathophysiology. Next we move on to the diagnostic evaluation. Diagnostic evaluations are those what evaluations or what diagnostic procedures we perform to assess that the person is having appendicitis. And for that, first we will collect the history from the patient. So we will collect the history from the patient, whether the patient is having pain at which site, and what is the history of the patient, and whether he was suffering from appendicitis, acute appendicitis before. So for that we will collect the history from the patient. Next we will do physical examination. Through physical examination or by palpating at the left side, that is our Rossing sign, through that we can analyze if the patient is having, while palpating at the left side, if the patient is having pain at the right side, we can analyze the person is having Rossing sign. Next, by positive signs and symptoms, as I have already told that by positive signs, by two positive signs that we can analyze are, one is Brudensi's sign, McBurney's point, and other one is Rossing sign. The first one is McBurney's point. McBurney's point, as I have already told, that the midway between the umbilicus and the iliac spine. So the midway between the umbilicus and the iliac spine, that spot is known as McBurney's point. And Rossing sign, while palpating at the left side, you will feel pain at the right side, because it is the movement of the bowel. Because of that you are feeling pain at the right side. Next, through ultrasonography, by doing ultrasonography we can find out whether the person is having appendicitis, and we can confirm it. By urine analysis, we can know the infection through which infective organism it has occurred, and if any type of urine infection is there, through that also we can analyze that the person is having appendicitis. These are the diagnostic evaluations regarding appendicitis. Now we next move on to the complications. What all are the complications that can occur because of appendicitis? So first, the perforation can occur. Perforation means that if the inflammation, if we are not doing medical management properly, or if we are not taking the management properly, so what can happen if we are not taking the right decision what to do with the appendicitis patient, then what will happen? It can lead to perforation. Perforation means rupture of the appendix, which can even lead to death of a person. Second one is abscess. If the inflammation is, when it is acute, we are not treating it well with antibiotics, so what will happen? It can lead to further abscess. And next complication is of appendicitis is peritonitis. Peritonitis means if the appendix has ruptured or the inflammation has spread to the adjacent. Peritonitis, we know peritoneum means it is the serous membrane which covers the abdominal cavity. So what happens? In peritonitis, the infection or inflammation can spread from appendix to the peritoneum. That is known as peritonitis. Next we move on to the management. Management includes medical management, surgical management, and nursing management. Medical management, if we look at the medical management means mainly pharmacological management. Pharmacological management includes, first we have to administer antibiotics to reduce inflammation. Next, as a person is having pain, to reduce the pain, we will provide analgesics as per the doctor's order. Next, we can apply cold applications such as ice bag therapy, and we have to provide patient with comfortable position. Next, as move on to the surgical management, I have already told that appendix is inflamed. So what happened? Because if we are not removing that appendix which has already been inflamed, so what will happen? It can lead to death of a person. So the surgical management which we are doing for appendicitis is known as appendectomy. Appendectomy means removal of the appendix. In this, what we are doing, that vermiform appendix which has been inflamed or which has been infected, we are removing that appendix and we are doing the surgery and we are removing this. And there are two types of methods through which we can remove the appendix. One is through laparoscopy, that is we are inserting a laparoscope through a camera, we are visualizing, and then we are removing that appendix. Next, the other one is open surgical method, through which we are opening, and nowadays what happened, opening the abdomen, and through which we are removing the appendix. Nowadays laparoscopy methods are usually done because it is less time stays there for hospital, so we are preferring for laparoscopic removal of appendix. Next, we move on to the nursing management. Nursing management includes the pre-operative care, post-operative care and the intraoperative care. Pre-operative care, what we have to do is we have to firstly prepare the patient for the procedure. So the person is not knowing about the surgical procedure what has to be taken in his body. So what we are doing is we are explaining the procedure to the patient, and first of all what we will do, we will obtain the consent from the patient and his patient's relatives that we are doing a surgical procedure and this is the procedure we are going to do, and we have to obtain a consent from the patient and patient relatives. After being we are admitting the patient to the ward, and then we are doing the all pre-operative procedures, that before surgery we have to do some investigations. So we are performing all those investigations, and when the report is normal, so we are taking the person for next day for the surgery. So before that what we are doing is we are preparing the patient. So in the preparation of patient, what we will do, we'll perform keep the person nil per roller 24 hours before 12 hours before the surgery. That is, next day if we are preparing the client for the surgery, we are keeping the person overnight. That is, after 10 o'clock we will ask the client not to take anything by mouth. The medicines or any fluids which has to be gone to the person will be supplied through IV applications. Then post-operative management, what we are doing, post-operative management will include that we will see the person if any complications are there, any oozing, any hemorrhage or any type of infections that occur in the person. So we will assess the vital signs, we will monitor the vital signs, and we are analyzing the patient whether he has any complications after the surgery. Thanks for watching my video. Kindly like, comment, share, subscribe our YouTube channel.